Real NHS interview questions part 2. Now this is part 1 of this series, and in this video I deeply tackle the question, how do you manage difficult situations at work, which is a very popular NHS interview question. So if you haven't seen it, check it out on my page. So in today's video I will be tackling the NHS interview question, if you're running late on your list, what do you do? Now this is also another common question that is usually asked, because there will be times, due to several factors, that you would run late on your list. It could be due to technical factors. It could be due to short staffing in the department. It could be due to staff reshuffling as well. Like if someone calls in sick, for instance, in one department, so they now need to reshuffle staff around just so that it could cover for that person who was called in sick. So that means that the time it would take me to leave from, department A to department B, by the time I get to department B, I might have patients already waiting for me, and that can cause me to run late on my list. Okay. And sometimes just in the middle of your list, your machine or your tools could just malfunction. And at that point in time, you now have to try sorting that out. And in doing that, it can cause you to run late on your list, and you start having a backlog of patients waiting for you. So the reasons can come from anywhere, and because of how frequently this can happen, it's understandable that this would be a popular interview question, because your employers, your potential employers, or the recruiter wants to know how you would tackle the situation like that, how you would manage that kind of situation, generally speaking. And so I'm here to give you some insight on how you can potentially tackle a question like this. And just in case you're not aware, my name is Rajuna. I'm a Nigerian trained sonographer in the UK, and on my channel, I provide you with insights and tips on how to achieve your dreams as a radiographer, a sonographer, or a healthcare worker in the UK. All right. So usually at the beginning of the day, you'd normally have like a list of patients that you would be attending to. And these patients usually have like allocated time slots, like almost like appointment times that they actually come to the hospital to be seen, right? And so if my 10 o'clock patient, for instance, is waiting, and by 11 o'clock, I've not yet attended to that 10 o'clock patient, then that means that I am running late on my list. So these are the things that I would do if I'm running late on my list. Yeah. Number 1, I would remain calm and I would prioritize examinations. Now, I would be prioritizing examinations based on the urgency of the situation and on patients' needs. So this could mean focusing on those patients who may require urgent or very time-sensitive scans, like patients who have got like acute medical conditions, or patients who are on oxygen, or patients who are in like debilitating pain. I cannot wait for too long in the department, or infectious patients, because if patients are waiting for me and one of them is infectious, then the longer the infectious patient stays with other patients, the greater the chances of the infection spreading to other people, to other patients and other staff. So I could prioritize an infectious patient just to get them back to the ward quicker. Yeah. So the first thing I would do would be to stay calm and do my best to prioritize, examinations based on urgency, based on patients' needs. Okay. So the second thing that I would do would be to communicate clearly and openly to my patient, right? So when you communicate with your patient, trying to explain to them what has happened, why there has been a delay in the service, or why they have been waiting for this long, what it does is it helps the patients to manage their expectations. And when their expectations are managed like that, it also helps to reduce their anxiety. It helps to reduce their frustration. Because if patients are waiting, they are waiting endlessly and nobody's telling them anything. I've got a 9 o'clock appointment. How come by 10 o'clock I'm not being seen? So nobody has talked to them. Nobody has said anything to them. That way they get frustrated. They're getting anxious. They're getting really, really upset and frustrated with whoever it is that's supposed to provide the service. But if you're able to communicate with them, if you tell them, there's been a technical difficulty, my machine just started to malfunction, something happened, that way it manages their frustration, it manages their anxiety, it manages their upset, and they do not have such huge expectations from you anymore, right? So communicating with your patient is a no-brainer. It's something you cannot compromise on. It's something you have to prioritize if your list is running late. Now, the third thing that I would do would be to inform the referring clinicians. Now, this would depend mainly on whatever department you are posted to. Like if you're posted to a department where it's an active running clinic, maybe it's a one-stop clinic where they are depending on your results to actually treat a patient or manage a patient. In clinics like that, or ward patients where as soon as they get your report, they know how to manage the patient. So if I'm in a department like that, then I would inform the referring clinician. Now, I would inform them, that there have been significant delays and these are the the reasons why there have been delays, and it's beyond me, and that's why this is happening or that is happening. Now, when the referring clinicians are informed about delays like this, it would help them to manage their own schedule. It would also help them to understand what's happening and why there have been delays in their patients returning back to them. It would help them in prioritizing their own patient management accordingly as well, right? So depending on the department that you're posted to, it might be very, very important that you call and you inform the referring clinician about significant delays to the service from your end, okay? Now, the fourth thing that I would do would be to streamline the workflow. And this basically means that if I'm experiencing delays, I would assess the workflow in the department and identify different areas where efficiencies can be improved. And I'll have to do that as quickly as possible. Now, to do this, it may involve delegating like non-clinical tasks to support workers, to the healthcare assistants, or to other admin staff. Whatever we can do to just help the service move on a little bit quicker, because we're already experiencing delays. So while the support staff are focusing on some non-clinical things, I can be focusing on the clinical things. Streamlining the workflow could also be about optimizing your equipment preparation and your equipment setup, basically. Whatever it is that I can do to just make the service run a little bit quicker, a little bit better, I would do that. And that's what streamlining the workflow basically means. Okay. The next thing that I would do would be to seek assistance if necessary. Now, if I'm experiencing delays and the delay is significant, or I'm experiencing some unexpected challenges, then I will not hesitate to seek assistance from my colleagues, from supervisors, from the manager, whoever it is that I need to seek assistance from. Because collaborating with others can just help to redistribute the workload. And by redistributing the workload, it will expedite the process as well, leading to very minimal disruptions in patient care. Okay, because if there's a huge chunk of work to do and it is broken into pieces and given to different people, that means we can all do it faster and we can help the patients get their care as quickly as possible. So seeking assistance if necessary is something that I would do if I'm running late on my list. And the sixth thing that I would do if I'm running late on my list would be to maintain professionalism and compassion. Now, throughout the process, while I'm trying to tackle the situation, manage the situation efficiently, I would prioritize professionalism, I would prioritize compassion, and I would prioritize patient-centered care. It's got to be all about the patient at this point in time. And one way to demonstrate compassion is to acknowledge the inconvenience caused by the delay to the patient. So by the time you acknowledge this to your patient and then you reassure your patient that regardless of everything that is happening, their well-being is a priority to you. That way, the patients feel more at ease, they are happier, and they understand that regardless of how long it takes, when it gets to their turn, you're not going to rush their scan, you're not going to rush the process, because you understand that their well-being is still a priority regardless of the setbacks. So acknowledging and even apologizing to the patients is a very good step in this direction of, maintaining professionalism and compassion and patient-centered care. Patients want to know that they are valued at all times. So it is within our responsibility to demonstrate this regardless of whatever setbacks that we are facing. Now, after all has been said and done, and we've, gone through the list and tried to manage this situation, the seventh thing that I would do would be to reflect on everything that has happened and to improve where possible. So after addressing the immediate concerns, I would take the time to reflect on all the factors that have contributed to the delay and identify areas for improvement. And this may involve evaluating the workflow practices, trying to understand the root of the delay in the first place. Was it an equipment malfunction? What happened? Or did this happen before? Was it reported before? I have to report it now, right? It's happened with me, and so I have to report this to the relevant personnel so that they can look into it so that a delay like this does not happen in the future. Because the last thing you want to do is put your patients through this and then put them through this again. You don't want to do that a second time. So if I have to report this, I have to follow the necessary channels, report an equipment malfunction. If the delay was as a result of staff shortages, then, there's not much that I can do about that. But considering everything that would have ensued, the managers would be aware of this, and hopefully, they'd put measures in place to not let this happen again, maybe by recruiting more staff or implementing other strategies that can help with preventing stuff like that in the future. And if I've got any ideas, if I've been able to brainstorm any ideas that can help the management to sort out stuff like this, then I'll put it forward to my management. Okay. So just to recap, if I'm running late on my list, I would prioritize examinations, based on urgency and based on the patient's need, right? Okay. And then number two, I would communicate with the patient very clearly, very openly, very transparently. This cannot be overemphasized. Yeah. And then number three, depending on where I'm working, I would inform the referring clinicians just so that they can also adjust their schedules accordingly. Yeah. And then number 4, I will streamline the workflow, look for any areas of inefficiencies and try to improve them as quickly as possible. And then number 5, I will seek assistance if necessary because this can just help to expedite the process and reduce patient delays. Okay. And then number 6, I will maintain professionalism and compassion and patient-centered care throughout the entire ordeal, right? And then number 7, after all has been said and done, I will reflect on the entire situation and try to identify areas for improvement. Okay, so these are the things that I would do. Now, what would you do? I'd like to hear from your experience, so you could just drop a comment below. I'm sure that I can learn from it and others can learn from it as well. And then in my next video on this series, I would be answering another 2 popular interview questions that I'm aware of, which are, where do you see yourself in 5 years, as a healthcare professional? And what does success mean to you? So if you've not subscribed to my channel, this is your cue to go and do that so you do not miss out on these very helpful videos. Okay? So you may have seen this video, but if you haven't seen this video, then you just may be doing yourself a disservice, because this is another very important video where an NHS boss actually opened up to me about the things that overseas applicants are just not doing right. And he also shared, an interview tip there with me, which can be very helpful to you. So if you haven't seen this video, don't sleep on it. Go check it out, okay, on my page. And if you need help preparing for your ultrasound interview, it is a service that I provide. I'll drop a link below. And again, if you've received any value from my video today or any of my other videos in the past, then please do not forget to subscribe, to like, to share, to comment, and I'll see you guys in my next video. All right, bye.